If you've been dealing with hair loss and finasteride, you've given it a try and it just isn't working for you, either you're not getting the results you wanted or you're experiencing some side effects, don't worry guys, I'm here to tell you there is another way and you don't have to stick with something if it's not working for you. And I'm going to be discussing why a hair system might be the perfect solution, not only because it gives you instant results, but because you don't get side effects and you can get your confidence back without compromising your health. Now, what is finasteride? Why am I talking about it? Why am I offering hair systems as a solution? And why do I feel I've got a bit of authority within this sector? Now, finasteride is a licensed prostate medication. It's also licensed for male pattern baldness. It has shown in the studies that it can halt the progression of hair loss. Not every time, I think it's about 83% of the time it can halt hair loss, and I think in about 66%, some people do see a level of regrowth. However, I'm talking about this topic because number one, it doesn't work for everyone. Number two, there is a side effect profile, which in my opinion is underreported, and I'll discuss the reasons why in a bit. And I feel that I'm an authority on this because I am an ex-finasteride side effect sufferer. That's quite a mouthful, but I am one. I experienced depression, I experienced low libido, I experienced a lot of fatigue, and those side effects lasted a long time after I stopped the medication. And I've come across so many people that have experienced exactly the same. And this is why I'm making this video, because there is a solution out there and it's safe. Now, how does finasteride work? Well, it works by blocking DHT. Now, DHT binds to hair follicles and over time it makes them thinner and finer, and it gives the appearance of baldness because it minimizes the hair follicles so much that you can't even see the small hairs that are left. So at the core of finasteride, it actually does prevent the hair loss, hair shedding process when it comes to male pattern baldness. However, as mentioned earlier in the video, side effects have been reported, vastly underreported in my opinion. Why have they been underreported? Well, the side effects themselves are actually quite common symptoms that we can develop naturally as we age. So a lowering of sexual libido does affect men as they get older. There is a mental health depression epidemic, especially in the Western world right now. So a lot of the time we may not associate that symptom with taking finasteride. Also, there's other medications that can cause these side effects that a lot of men might be on as well, and therefore wrongly associate the side effect with that particular medication. And of course, lastly, men are renowned for underreporting symptoms. They don't like going to the doctor. They don't like talking about their health if they're suffering. And that is something we really need to address as a gender more generally, but that's beyond the scope of this video. So that's my rationale as to why I think these side effects are underreported. There is also a condition called post-finasteride syndrome. Now, this is something that I think I experienced, and it relates to lingering side effects. So I had side effects from finasteride. For over a year after stopping the drug, I had depression, I had lower libido, and I just felt super fatigued a lot of the time. And it took a really long time for actually all of these symptoms to pass. It certainly wasn't overnight. Now I want to talk to you about the solution which I'd personally recommend, and that is hair systems. I wear a hair system. I've been wearing a hair system for like 6 years now. And if I compare my time on finasteride to my time on hair systems, it's night and day. Why? Number one, and most importantly, there are zero side effects. I don't get any side effects from wearing a hair system. I got a ton of side effects when I was on finasteride. Number two, I don't have to worry about taking a pill every single day. Once, about every 10 to 14 days, I clean up and put on my hair system again. If I don't want to do it one day, that's fine. I can wait a few more days. It's not a problem. There's no level of urgency. And number three, hair systems are getting so good right now, they can be virtually undetectable, especially Swiss lace and ultra thin skins. You can genuinely get the results you want with a hair system now. With finasteride, brand name Propecia, can it stop hair loss in its tracks? Yes, in 83% of cases it can, but you have to take the medication every day and you have to get it early. If you wait too long, you will lose too much hair, and that hair, based off the clinical studies, that hair does not grow back. You will not grow back a full head of hair if you start taking finasteride after about 1 or 2 or 3 years of noticing any sort of hair loss. And when it comes to actually growing back hair, from a medication perspective, minoxidil's not that great either. So I suppose, do you want instant results, a full head of hair? Or do you want something to stop your hair loss? It might have already progressed quite a lot without any hope of actually growing back the hair that you've lost. So in my opinion, hair systems are perfect for guys who want to take control of their hair loss without having to deal with the what-ifs of medication. Now let's discuss another factor as well. Let's say you wait a couple of years to actually have some sort of intervention when it comes to dealing with your hair loss. You've lost around the temples, you might have lost around the front, you might have lost some at the crown as well. You take finasteride, it halts the progression of your hair loss. However, it doesn't give you the result, the full head of hair that you want. You're going to have to fork out money on potentially getting a hair transplant, and you'll still have to take finasteride as well. You have to pay for that to keep the current hair that you've still got. So you're forking out even more money. And if we're being financially practicable, which is what this channel is all about, it doesn't really make much financial sense. And I can speak to loads of guys who have transitioned from finasteride to hair systems, have had a really positive experience. I can't think of anyone that I know who's transitioned from hair systems to finasteride because they thought it was too much effort, they weren't happy with it, or they couldn't afford it. And I recall when I went on finasteride, and this is going back 15 years, I first went on finasteride. I went on finasteride and I went on minoxidil through a clinic. I was paying £80 a month. That's roughly about $100 a month, right? That's more than what I pay for a hair system. A hair system usually lasts me about 3 months, and it equates to maybe about £80 or $100 a month overall. So I'm paying the same, but with a much better result. And if you account for inflation as well, in those 15 years, that £80 or $100 is probably about $150, $160 now. So I'll be spending more getting a worse result with minoxidil and finasteride than I would getting a hair system with a much better result, a fuller head of hair, where I'm taking control of my hair loss. Now in this segment of the video, I wanted to address some concerns that you might have around hair systems. Say you're taking finasteride, but hair system seems like a pretty big and significant leap. How am I going to explain this to my friends? I haven't told them that I'm taking finasteride or minoxidil. That seems more subtle. A hair system, I turn up one day and I've got a full head of hair. I'm going to have to explain to them. Now, what I can say is explaining to people what you've been going through and the fact that you're taking control of your hair loss is one of the most empowering things I ever did. And the amount of positive, encouraging remarks that I got from people really surprised me, and it really blew me away. If you have people take the mick out of you, they're probably not your true friends. But just a hunch of mine, I think you'll get some pretty positive feedback. Now, say you don't want to tell the whole world in this, son. Well, that's fine, because as I mentioned earlier in the video, hair systems nowadays are super realistic, especially Swiss lace and French lace and ultra thin skins. They look really good. This is an ultra thin skin. I've never had anyone come up to me, friend or otherwise, or even a work colleague or anything like that, say, are you wearing a wig? Are you wearing a toupee? Never. If we're looking at expense over a lifetime, it works out cheaper than minoxidil and finasteride if you do it yourself. If you watch my videos, if you follow the recommendations I make, you'll save money having a hair system over finasteride or minoxidil, or both. How do I care for it? Check out my tutorials playlist. It's got all of the information, all of the content you could ever need. You'll never need to go anywhere else other than this YouTube channel for a thorough explanation of everything you need to do. If you are worried, I also offer one-on-one consults. You can find out that information in the description box below. But look, I get it. Trying something new like a hair system can be really overwhelming, and it can feel like a tough decision to make. I remember when I was going through this decision-making process, and it felt like such a big deal. But trust me, it's worth it. And if you ever need encouragement, just pop a comment in the comments box below, and I answer every single comment that comes onto my channel. And one final suggestion, if you don't feel ready to come off the finasteride, and let me say this is not medical advice, I am not a medical professional, but I have seen that some people, they seem to get on a little bit better if they lower the dose of the finasteride. Obviously, I'd encourage you to speak with your doctor. I think the serum levels of the actual medication do maintain themselves at lower levels. You might find the side effect profile reduces. But as I said, I'm not a medical doctor, but if you want to expand on that, maybe speak to your medical professional and they might be able to give you some better insights. And remember, hair loss doesn't define you, whether it's hair systems or finasteride or another option. What matters most is finding out what works best for you. Now, do you feel that you're at a crossroads with whatever hair loss treatment you're on at the moment? You're not sure if it's the right thing for you. Maybe, you're not getting what you were hoping for with finasteride or minoxidil and you're looking for something else. Have you actually been through finasteride and had these kind of side effects that I've certainly had and a lot of other people within the hair loss community have had? Let me know in the comments box below because it really helps other people make more informed decisions. Don't believe everything you read on medical news today because, as I mentioned at the top of this video, I think, in my opinion, from what I've seen, a lot of these side effects are massively underreported. I hope you've liked this video, guys. If you haven't subscribed yet, please do. We're trying to build up that subscriber base, allowing these kind of videos to reach more people, more hair loss sufferers who are looking for solutions just like you. Now, a while back, I made a video on finasteride where I talked about it being investigated by the European Medical Agency. You might want to check that out. It's popping up on the screen right now. Thanks for sticking around till the end, guys, and I'll speak to you soon.